Atorvastatin, widely known by the brand name Lipitor, is one of the most prescribed cholesterol-lowering medications in the world. Millions of people take it daily to reduce their risk of heart attack and stroke, and for many it works exactly as intended. But while its benefits are well proven, atorvastatin is not without risks. Some side effects may be mild and temporary, such as a little stomach upset or a slight headache. Others, however, can be far more serious, affecting your muscles, liver, kidneys, or even your memory. The tricky part is that many of these warning signs can be subtle at first, making them easy to ignore until they have already caused significant harm. In this video, we'll explore 9 of the most important side effects you should never overlook while taking atorvastatin. You'll learn how to spot the early warning signs, why they happen, and the steps you can take to protect yourself without giving up the heart protective benefits of this medication. Let's start with one of the most well-known and potentially troublesome side effects of statin drugs: muscle pain and weakness. 1. Muscle pain and weakness. Muscle pain and weakness are among the most common complaints from people taking atorvastatin. For some, it's a mild soreness that feels like post-exercise fatigue. For others, it can be a deep, persistent ache that affects daily activities, from climbing stairs to simply standing up from a chair. This discomfort can occur in any muscle group, but it's most often noticed in the legs, back, and shoulders. The reason statins, like atorvastatin, can cause muscle issues isn't fully understood, but research suggests they may interfere with the way muscles produce energy, particularly by affecting mitochondrial function. In most cases, the symptoms are mild and improve after lowering the dose or switching to another cholesterol medication. However, in rare but serious situations, muscle pain can be a sign of rhabdomyolysis, a condition where muscle tissue breaks down rapidly, releasing proteins into the bloodstream that can damage the kidneys. Warning signs of this complication include severe muscle pain, extreme weakness, dark or cola-colored urine, and unexplained fatigue. If you notice these symptoms, you should seek medical attention immediately. To reduce your risk, take atorvastatin exactly as prescribed and report any new muscle discomfort to your healthcare provider promptly. Staying hydrated, avoiding excessive alcohol, and maintaining a balanced diet rich in protein and essential nutrients can also help keep muscles healthy. Sometimes your doctor may check a blood test called creatine kinase, CK, to see if muscle damage is occurring. If levels are elevated, stopping or adjusting the medication can prevent further harm. While muscle pain and weakness can be unsettling, it's important not to stop atorvastatin on your own without guidance. Many cases can be managed safely with the right adjustments, allowing you to continue benefiting from its powerful heart protective effects. Next, we'll look at another potential issue that's less obvious at first but just as important: changes in liver function. 2. Liver function changes. Your liver plays a central role in processing cholesterol, and atorvastatin works by blocking an enzyme in the liver that helps make cholesterol. While this mechanism is effective for lowering bad cholesterol, LDL, it can sometimes put extra stress on the liver itself, leading to changes in liver function. For most people, these changes are mild and show up only in routine blood tests as slightly elevated liver enzymes. These elevations often don't cause symptoms and may return to normal on their own. However, in some cases, liver stress can progress to inflammation or more serious damage if not addressed early. Possible warning signs of liver problems include unusual fatigue, loss of appetite, nausea, vomiting, dark urine, pale stools, or a yellow tint to the skin or eyes, a condition known as jaundice. These symptoms should never be ignored, as they may indicate significant liver injury. Doctors typically monitor liver function with blood tests before starting atorvastatin and periodically during treatment, especially in the first year. If liver enzymes are significantly elevated, your healthcare provider may lower your dose, switch medications, or pause treatment to allow recovery. Certain lifestyle factors can increase the risk of liver-related side effects. Drinking alcohol heavily while taking atorvastatin is a major contributor, as alcohol itself can damage liver cells. Pre-existing liver conditions, such as hepatitis or fatty liver disease, can also make you more vulnerable. To protect your liver while on atorvastatin, limit alcohol intake, maintain a healthy weight, and eat a balanced diet low in saturated fats and processed foods. Foods rich in antioxidants, such as berries, leafy greens, and nuts, may also support liver health. While liver problems from atorvastatin are uncommon, they are serious when they occur. Early detection through regular monitoring is the key to preventing long-term damage, while still enjoying the medication's cardiovascular benefits. Next, we'll move on to another common area of concern: digestive problems like nausea, diarrhea, and constipation. 3. Digestive problems, nausea, diarrhea, constipation. Digestive problems are among the most commonly reported side effects of atorvastatin and can range from mild discomfort to symptoms that interfere with daily life. Some people experience nausea shortly after taking the medication, which may be related to the way statins are metabolized in the liver and interact with the digestive system. Others may develop diarrhea, which can cause dehydration if it persists, or constipation, which can be uncomfortable and lead to other complications if left untreated. While these issues are generally not dangerous, they can become bothersome enough to affect adherence to treatment. Nausea may improve if you take atorvastatin with food, as this can help buffer the stomach lining and slow absorption, making the medication gentler on your digestive tract. Diarrhea often responds to dietary adjustments, such as reducing high-fat or overly spicy foods, while constipation can be alleviated by increasing fiber intake through fruits, vegetables, and whole grains, as well as drinking enough water. It's important to note that digestive symptoms can sometimes overlap with more serious problems, such as liver or pancreas issues, which also cause nausea or abdominal discomfort. If your digestive symptoms are severe, persistent, or accompanied by other warning signs like significant weight loss, fever, or dark urine, you should contact your healthcare provider immediately. They may adjust your dosage, recommend supportive treatments, or in rare cases, switch you to another cholesterol-lowering medication. Keeping a food and symptom diary can help identify whether certain meals or habits trigger your discomfort. Gentle exercise like walking can also improve digestion and relieve bloating. Although digestive problems can be frustrating, they are often manageable with small lifestyle adjustments, allowing you to continue benefiting from atorvastatin without giving up your comfort. In the next section, we'll discuss a side effect that surprises many people: memory loss and cognitive issues. 4. Memory loss or cognitive issues. Memory loss and cognitive issues are less common but still reported side effects of atorvastatin, and they can be particularly concerning for older adults. Some patients describe moments of forgetfulness, difficulty focusing, or feeling mentally foggy during conversations or daily tasks. These symptoms can range from mild lapses that are easy to overlook to more noticeable changes that disrupt work, hobbies, or personal relationships. The exact reason why statins might affect memory is still debated, but one theory is that because cholesterol is vital for brain cell function and communication, lowering it too much in certain individuals may impact cognitive performance. Another possibility is that statins could influence blood flow or inflammation in the brain, indirectly affecting memory and thinking. While many people never experience these symptoms, those who do often notice them within weeks to months of starting the medication. Fortunately, in most cases, memory and concentration problems improve or disappear after adjusting the dose or switching to a different statin. If you or your loved ones notice unusual forgetfulness, confusion, or changes in mood or personality, it's important to bring it up with your doctor rather than assuming it's a normal part of aging. Your healthcare provider may perform cognitive tests or review your other medications to see if there's an interaction contributing to the problem. Keeping your brain active with reading, puzzles, learning new skills, and maintaining social connections can also help support cognitive health while on statin therapy. Additionally, regular physical exercise and a diet rich in omega-3 fatty acids from fish, nuts, and seeds may benefit brain function. While cognitive side effects from atorvastatin are not common, staying aware of them ensures that you can act quickly if they appear, balancing heart health with mental sharpness. In the next section, we'll look at a side effect that affects metabolism: increased blood sugar levels. Atorvastatin 5. Increased blood sugar levels. One lesser-known side effect of atorvastatin is its potential to slightly increase blood sugar levels, which can be particularly important for people with diabetes or prediabetes. While the rise is usually small and may not cause symptoms in most individuals, it can still push those at risk closer to a diabetes diagnosis or make blood sugar control more challenging for those already managing the condition. The reason behind this effect is not fully understood, but some studies suggest that statins may alter the way the body processes glucose or affect insulin sensitivity. For most patients, the heart protective benefits of lowering cholesterol outweigh this small risk, but awareness allows for better monitoring and management. People taking Atorvastatin should have their fasting blood glucose or HbA1c levels checked regularly, especially in the first year of treatment. If you notice symptoms such as increased thirst, frequent urination, unexplained fatigue, or blurred vision, you should contact your healthcare provider to discuss whether your blood sugar levels have changed. Managing this side effect often involves dietary adjustments like reducing refined carbohydrates and added sugars, increasing fiber intake, and incorporating regular physical activity to improve insulin sensitivity. In some cases, your doctor may make changes to your diabetes medications or recommend additional strategies to maintain stable blood sugar. It's important not to stop atorvastatin abruptly because of a mild rise in glucose levels, as the risk of heart attack or stroke from uncontrolled cholesterol is often far greater. Instead, work with your healthcare team to strike the right balance between cardiovascular protection and blood sugar control. In the next section, we'll cover a side effect that can range from mild skin irritation to severe medical emergencies: allergic reactions. 6. Allergic reactions, rash, swelling, breathing issues. Allergic reactions to atorvastatin are relatively rare, but when they do occur, they can range from mild skin rashes to severe and potentially life-threatening conditions. Mild allergic responses may include itching, redness, or hives on the skin, which can be uncomfortable but are often manageable with medical guidance. However, more serious reactions involve swelling of the face, lips, tongue, or throat, known as angioedema, which can interfere with breathing and swallowing. In the most severe cases, a reaction called anaphylaxis can occur, causing sudden shortness of breath, rapid heartbeat, dizziness, and a drop in blood pressure. This is a medical emergency that requires immediate attention. Allergic reactions can develop soon after starting atorvastatin, or even after long-term use, making it important to remain alert to any unusual symptoms. People with a history of allergies to other statins or multiple drug allergies may be at higher risk. If you notice any signs of an allergic reaction, stop taking the medication and contact your healthcare provider or seek emergency care right away. Treatment for mild reactions may include antihistamines or corticosteroids, while severe cases require urgent intervention. To minimize your risk, inform your doctor about any allergies before starting treatment, and read the medication guide carefully so you know what to watch for. While allergic reactions are uncommon, recognizing them early is critical, as prompt action can prevent serious complications or save your life. In the next section, we'll look at a rare but serious complication that can involve both the muscles and the kidneys: rhabdomyolysis and kidney problems. 7. Kidney problems, including rhabdomyolysis. Kidney problems related to atorvastatin are most often linked to a rare but serious condition called rhabdomyolysis, in which muscle tissue breaks down rapidly and releases a protein called myoglobin into the bloodstream. This protein can overwhelm the kidneys, leading to acute kidney injury and, in severe cases, permanent damage. Early symptoms of rhabdomyolysis include intense muscle pain, extreme weakness, swelling, and dark tea-colored urine. Because this complication can progress quickly, it requires immediate medical attention. Even without rhabdomyolysis, kidney function can sometimes be affected by atorvastatin, particularly in people with pre-existing kidney disease, dehydration, or other health conditions that strain the kidneys. Warning signs of kidney problems include swelling in the ankles or feet, decreased urination, fatigue, and shortness of breath. To reduce the risk, it's important to stay well hydrated, avoid excessive alcohol, and be cautious with over-the-counter pain relievers like NSAIDs, which can put extra stress on the kidneys. Your doctor may order regular blood and urine tests to monitor kidney health while you're on this medication. If kidney issues are detected early, They can often be managed by adjusting the dose, switching to another statin, or pausing treatment temporarily. While kidney problems from Atorvastatin are rare, they can have serious consequences, so recognizing the signs early and acting quickly is the best way to protect both your kidney health and your overall well-being. In the next section, we'll look at another side effect that can impact daily comfort: headaches and sleep disturbances. 8. Headaches and sleep disturbances. Headaches and sleep disturbances are side effects that may not be dangerous in most cases, but can still have a significant impact on quality of life for people taking atorvastatin. Headaches can range from a mild, dull ache to more intense pain that interferes with concentration in daily activities. These headaches may appear shortly after starting the medication or after a dosage change, and while the exact cause is not fully understood, it could be related to changes in blood flow or the way statins affect certain chemical processes in the body. Sleep disturbances, on the other hand, can manifest as difficulty falling asleep, waking up frequently during the night, or experiencing vivid dreams or nightmares. Poor sleep can lead to daytime fatigue, irritability, and reduced focus, which in turn may make it harder to manage other aspects of your health. To minimize headaches, it can help to stay hydrated, avoid skipping meals, and limit caffeine or alcohol intake, which can make headaches worse. For sleep problems, practicing good sleep hygiene, such as keeping a consistent bedtime, reducing screen time before bed, and creating a calm, dark sleeping environment can make a difference. If these symptoms persist or worsen, talk to your healthcare provider. They may suggest adjusting your medication schedule, lowering the dose, or switching to a different statin that is less likely to cause these effects. While headaches and sleep issues are usually manageable, addressing them early ensures that you can continue benefiting from atorvastatin without unnecessary discomfort. In the next section, we'll discuss a less common but still important concern: vision changes. 9. Vision changes. Vision changes are an uncommon but notable side effect of atorvastatin that should never be ignored. Some people report experiencing blurred vision, difficulty focusing, or seeing halos around lights, while others may notice eye discomfort or dryness. Although these symptoms are not typical for most patients, they can be unsettling, especially for older adults who may already be managing age-related eye conditions like cataracts, glaucoma, or macular degeneration. The reasons why statins might affect vision are not entirely clear, but possible explanations include changes in blood flow to the eyes, alterations in nerve function, or side effects from metabolic changes induced by the drug. In very rare cases, vision problems could be linked to more serious conditions such as optic nerve inflammation or increased intracranial pressure, both of which require immediate medical attention. If you notice any sudden or significant change in your vision, it's important to stop what you're doing and contact your healthcare provider promptly. They may recommend an eye exam, adjust your dosage, or switch you to a different cholesterol medication. In some situations, vision changes may be temporary and improve once the drug is discontinued or the dosage is lowered. To protect your eye health while taking atorvastatin, keep up with regular eye checkups, maintain good control of other health conditions like diabetes and hypertension, and eat a nutrient-rich diet that supports vision, including foods high in vitamin A, lutein, and omega-3 fatty acids. While vision changes from atorvastatin are rare, being aware of the possibility ensures that you can respond quickly and preserve your sight if symptoms arise. In our final section, we'll recap all 9 side effects and share practical steps to stay safe while taking atorvastatin. Atorvastatin is a proven and effective way to lower cholesterol and protect your heart, but as we've seen, it can sometimes cause side effects that deserve attention. We've gone over 9 key ones, from muscle pain and liver changes to memory issues, kidney problems, and even vision changes. Most of these can be managed if detected early, but ignoring them can lead to serious health consequences. That's why it's important to listen to your body, keep up with regular checkups, and talk to your doctor about any new symptoms. Never stop your medication suddenly without guidance, because the benefits for heart health are significant. If this video has helped you understand your medication better, please take a moment to click the like button, leave a comment below with your experience or questions, and most importantly, subscribe to the MediMint channel. Here we bring you clear, reliable, and easy-to-understand health information designed especially for people over 50 who want to live longer, healthier, and more confident lives. Join our MediMint community today because your health journey is worth sharing and protecting.